everyone. Thank you for joining us on this Friday. Welcome to Ealthy with SLC for this webinar.
Hello everyone and welcome to our webinar for today. My name is Bethan Edwards and I am here to introduce the webinar to you. So today we are delighted to have Alexia Sporidis who is going to be talking to us about developing speaking materials for nursing English. So some ideas that you can use to develop your own materials and use them in your classroom. We're really looking forward to sharing these ideas with you and also hearing about your experiences from your healthcare classroom as well. So I am going to hand over to Alexia, who's going to run our webinar today.
Thank you, Bethan. Hello, everyone. Welcome to the Ealthy SLC webinar for today on developing speaking materials for nursing English. So just to go over a couple of things in using Zoom. I'm sure all of you are very familiar with using Zoom after the last couple of years. However, just to be clear, we've got the chat where you have already started participating, which is great. So that's for completing tasks during the session. We've got one poll today, so if you can answer the poll questions when you're invited to and then click submit, that would be great. And then at the end, we've got the Q&A where you can put your questions and we will endeavour to answer them. Yeah, so we'll see how we go. So actually the first thing I'm going to do is run a poll because I'm really interested to see that you're from all over the world, from Japan and Italy and Kosovo and goodness gracious, all over. So what I would like now to do is to run this poll and to find out what materials you generally use for speaking in your classes. So I've put some options here. This is by no means a fully comprehensive list, but I put in prepared role plays, YouTube, patient information pamphlets, and other. So depending how many people choose other, I might invite you to put some of those other ideas into the chat. That would be great. So I'm going to launch the poll now. That should come up on your screens. So if you'd like to just decide what you generally use, that would be really helpful. Always good to know what other people are doing and to share knowledge and share ideas. Oh, okay, so there's a fair amount of other coming in, that's good. Prepared role plays, YouTube, not so many. Patient information pamphlets, not so many. Okay, so more between prepared role plays and other at the moment. I'll give you another minute to make your votes and then I'll end the poll and share the results with you. Okay, so I think that's all. There's more people voting. Great, nice to see. So I've got 80% people voting. Please vote now if you haven't already. Make your choice between prepared role plays, YouTube, patient information pamphlets, or other. Okay, so I'm going to end the poll now. And I'm going to share the results with you. So, as I thought might be the case, we generally, when working with nursing, we use prepared role plays. And it's interesting to see that most people have chosen that. Only 7% chose YouTube, 7% had patient information pamphlets, and 5 of you out of the participants that voted chose other. So I'm genuinely very interested to know what other is. So I would now like to invite you to put in the chat what those of you who chose other, what do you mean? What are those other things? Reading text and discussion. Oh, okay. Q&A. Okay. Any other ideas of those of you who chose other? Speaking based on prompts, exercises and quizzes, cases and other tasks. Okay, yeah, for medical students. Yeah, today is with nursing. Anything else that you'd like to contribute? Prepare role plays, but I use scenarios from TV series. Okay, great. Yeah. Oh yeah, from The Good Doctor. Great, those are some really, really nice ideas, all of which are valuable in class, absolutely. Thank you so much for sharing your other ideas. Okay, so obviously there are, as we can see, there are lots and lots of different materials we can use to develop speaking in class. I've just chosen a couple today that I'm going to talk about in more detail. So the first one is MERTA, which is patient information. I've also added here YouTube because I know a lot of people do use YouTube in order to, for example, TV series that are on YouTube. Speaking role plays taken from OET quite often, and nursing websites. So the first topic I'm going to talk about is MERTA, patient information. MERTA patient information is an absolutely brilliant, invaluable resource. I use it a lot in my classes. Actually, I use it both with nurses and with doctors, but today our focus is on nursing. This can be used for giving clear explanations and also generating role plays for nursing interview practice. It's an incredibly effective tool and completely reliable in terms of information and accuracy. It falls into different categories. So MERTA touches on men's health, women's health, children's health, general health. So because it covers all bases, you can generate so many materials from it and develop it in various ways. So one of the things that I regularly do is using the diagnosis in MERTA. Here's an example, what is asthma? For clear explanations. So helping nurses to give a clear explanation. It's an area that they often struggle with, and they're, you know, in terms of accessing materials that they can use autonomously as well as you can use in the classroom. This is incredibly useful. So here we can turn it into a mini role play of giving an explanation. And here I've just given a small example of the kind of thing that I might do in class. Is it okay if I explain what asthma is? Asthma is a common chest condition that affects the air passages of the lungs. Now, as you can see here, Myrta uses patient speak, but it also offers medical terms. So for nurses who are struggling between those two levels of English, this is great. And you can work with them to develop that language and find a way through using patient speak versus the medical terms that they were trained in using. The next part of the explanation can be of symptoms and treatments. So symptoms and treatments are clearly labelled and laid out in Myrta. So in terms of you using those materials, it's quite easy to generate a lesson plan from and very easy to put it into a context. So as you can see here, here are the symptoms clearly laid out, and here are the treatment options. So for nurses, they can be not only practicing their topic knowledge, but also creating mini role plays using this language. So for the mini role plays, they can with you, they can discuss the topic, they can learn how to explain it in lay terms, and you can introduce the language that they need in order to do that effectively. So in there you can incorporate the signposting, cohesive devices, and question forms. So as you can see in the second point here, that giving clear explanations for treatment, I've incorporated the kind of questions that you might contextualize with your students. Okay, so the next thing that I'd like to discuss is informational videos. Informational videos are a very different kind of resource. They can be used also for checking understanding of the topic, but also to generate vocabulary and to work on pronunciation, and of course, ultimately, to create a role play. Here is one source that I use quite regularly. This is the Health and Care Video Library. This one, it covers every single topic imaginable in terms of healthcare, and it's really comprehensive. I'm actually just going to show you a little bit just so that you can see a little sample.
Fracture is a broken bone. A bone can break in a number of different ways depending on the type and severity of injury and where in the body the bone is located. Although bones are rigid, they are able to bend slightly. However, just like a plastic ruler that is bent too far, the bone will eventually break. How the bone breaks depends on how much force is applied. If the force is...
So as you can see, it's clearly stated here, and the language is very clear for students to understand. From this, there are all kinds of activities that you can create, and this material can be developed for various things. So one of the things that I do, I quite often use it for hedging language, in fact, because they use quite a lot of hedging language when they're discussing the topic. For topic understanding, for summarising verbal summaries and presentations on a medical condition, and also, of course, to develop their pronunciation.
Fracture is a...
So when we're thinking about informational videos and developing materials, although they are about 5 minutes long, we can use an excerpt from that, and students can not only note down key vocabulary, but as I mentioned, they can create a summary, give a presentation. They can also have a discussion and a Q&A, as some of you have mentioned in the chat. So a discussion leading to a Q&A on a topic can be very beneficial for students and help topics become more memorable for them. In this case, the discussion could be on different types of bone that commonly break and types of break. So by discussing different names of fractures and again, thinking of how they could explain that in lay terms to a patient. So again, working towards a role play as an ultimate conclusion. What I would now like you to do is to put in the chat how you think you could use the informational video of which I showed you a little brief sample of. How do you think you could use that in your classroom? So if you'd like to post in the chat. Ian, would you like to expand on your comment? You've said for homework, I prefer live teaching. So if you'd like to share some of the ideas of work on word families, okay, great. In class, you prefer no videos, the students and I talk. Ah, okay, all right. So I mean, we're just talking about a couple of minutes in order for them to gain that vocabulary as part of a listening activity. Phrases and words, yeah. As an activity to understand how to explain a condition, absolutely. Videos are for homework, okay. Students write a report and analysis, okay. Yes, using phrases can be really beneficial. So picking out the appropriate medical collocations. Yeah, so there are specific collocations, aren't there, when people are discussing healthcare topics. Okay, so the next thing I would like to discuss is creating role plays. So obviously there are pre-prepared role plays that people use, but it's not it's by no means completely comprehensive. So by generating our own and teaching our students how to generate their own can be really beneficial, partly because it's part of their analysis and understanding, but also it means that we don't need that many resources in order to develop full lessons on speaking. So first of all, we're going to look at generating role plays from patient information leaflets, which goes back to matter, and the patient information videos. So both of those can be developed in order to create role plays. You have to excuse me, I've got a tickle. So initially, we can generate a list of commonly used function verbs in nursing setting. Function verbs that would be used while interacting with a patient. Of course, there's an enormous amounts of verbs that can be used. I have just chosen 6 here. So generally in role play, nurses are required to explain things, be reassuring, give advice, find out information, possibly persuade a patient in certain circumstances, and regularly empathise. So I have written this in steps so that you can see one of the ways that you can do a class session quite simply and easily. So step 1, choose a topic that's appropriate for the learning week. So I've chosen bones and fractures because that relates back to the patient information video that we looked at earlier. Step 2, you can use the NHS, Mayo Clinic, health and care videos, patient information leaflets for common nursing topics. So the ones that I've chosen were the health and care video library and MRTA. Step 3, invent a patient. So here's my patient, Irina Lastari. Step 4, create a setting and a scenario around the fracture. For example, accident and emergency, the patient slipped and fell off a step on the way to work, causing a broken arm. Step 5, consider the function tasks to perform the interview or consultation, depending how you like to refer to it. For example, finding out. So if we're finding out, we can then feed in for our nurses the use of open and closed questions to gather information and funneling questions for more detailed information from the patient. Explain. So again, we can relate back to MRTA and the informational videos in order to talk through the steps for assessment and the management. So we can use the information from the patient information leaflet or the informational video, and we can apply that into the explanations that we worked on previously. So in this case, the explanation may include the steps for assessment, the management, the treatment options. Reassure. So we may be looking at exploring the concerns and again the care management, which again would come from the patient information leaflet and information videos, and any ongoing support which is already taken from those leaflets. So all the information we need in order to create the role card ultimately can be taken from the patient information leaflet or the patient information videos combined. So what we have created is a role card that can look something like this. It could be more detailed than this. You could also, of course, include language at the bottom that you want your nursing students to focus on. So here we've created the setting, the scenario, and then the function tasks. Now, although we as teachers can create this, of course our students can also go and create them themselves. If they have the steps and you have scaffolded the task, then they can go away and work autonomously on creating their own materials in pairs or in groups. So it's quite an effective way of generating materials. We've started with patient information leaflet, and we've developed it until it actually becomes a usable material that can be used, adjusted and adapted in a classroom environment. Okay, the next one I would like to talk about is handovers. So handovers, of course, are quite tricky because they need to be absolutely accurate. And I found when I teach clinical communication skills to qualified nurses that it's the area that they really struggle in, because if it's not quite right, something bad could potentially happen. So I feel that when we're working with nurses that focusing on handovers is a really important area. Handovers are obviously quite complicated and can be very, very detailed, and it's challenging for people who are doing this in a second language. So I'd now like to know if any of you do use handovers in class with your students. How do you develop speaking materials for handovers? So if you'd like to put that in the chat, I'd be really interested to hear your ideas. So if you can choose everyone rather than just hosts and panelists, then we can be sharing ideas. So how do you develop speaking materials for handovers for your nursing classes? If you do, if you don't, just pop in there, I don't. Oh, great, okay. Oh, okay. Yeah, great. That's really good, Andres. I also do that. It's incredibly beneficial for them, isn't it, to use recordings of handovers and then get students to make the notes and then say it back of what they've understood. Oh, thank you, Alex. Well, yes, we're going to cover a bit more on handovers today. Alexandria, follow up on patient role play, create scenario of department transfer. Yeah, great. And role play via phone handover. Yes, so important these days, of course, because they're doing from department to department, ward to ward. So yes, by phone is really important, which is where that listening to a recording and making notes, of course, is invaluable. Very interesting. Yeah, great. Never use them. Okay, you don't know? Okay, well, you're going to find out some more information now about them. Thank you very much for sharing your ideas and for letting me know whether you do use them or not, or whether you've ever used them. Okay, so a handover, as I said, is a very tricky area, and nurses find it very challenging. They get scared, their anxiety goes up because they know that if they miss something out or if they get something wrong, something could happen to that patient, or that the nurse, in fact, could be in quite serious trouble. So it's quite an important area. So I'm going to talk about handovers where we are using SBAR, which is the format used in handovers in the UK for the NHS, but also in private hospitals, and looking at role plays and how to do handovers. So first of all, I use a template. This template is from High Speed Training, and it's actually in PDF format, so you can download it. And you can generate as many as you want in PDF for your nurses. So as you can see, it's done in the normal order of a handover, the correct order, I should say, not normal, the correct order. So here it covers patient, location, the date they were admitted, the date today, the ward and the team that's working with that patient, the shifts and the shift leaders, current and next. It then goes on to work out the ISBAR part. So this S is for situation, where it covers current condition and status, recent actions, the medication, special notes, and any other information. So any other information may include mobility, any other help or support that might be needed. It then moves B for background, so relevant medical history, relevant personal needs, and past medication requirements. So it's quite detailed, and nurses are expected to be able to communicate all these elements in this order for a handover to another healthcare professional, usually to a colleague when a shift is changing. But it can be when there is a transfer, for example, a ward transfer. So A is for assessment, where it covers current issues, risks and concerns. This could be, for example, high risk of falls. Current and anticipated needs may be a requirement of oxygen should the patient become breathless. Recommended future actions, by when, so again, timescale. Required medications, and by when, again, this would include any dosage and expectation of when that should be given, and any other information. So, handovers require detail and they require accuracy, and our nurses need a lot of help in this area. So from nursestudy.net, you can actually access, I've chosen asthma because this relates back to MRTA again. So here you can access information on nursing interventions and rationales. So if the topic is new or that's your topic of that session, then you've also got the relevant functions here, like assess, encourage, administer, elevate, and so you can incorporate a lot of things in here. You can use the function tasks that we've already looked at before, the actual detailed information on how a handover would go with nursing intervention for a condition. And they've got a template, so they can take the information from the nursing interventions and apply it to the template of the handover. As some of you had mentioned in chat, there are recordings available of handovers for nurses. And one of the things that can be done is they can listen, make notes, and then give a verbal handover to a colleague using a template. So while they're listening, they can complete the template, or they can complete it themselves and then they give a verbal handover. This can be used to utilise medical terms and universal abbreviations. It can also help them learn how to manage collocations that are used in hospitals and in clinics and surgeries, where there are particular collocations. For example, she is at high risk for falls, which grammatically sounds strange to our ears as teachers, but in a hospital environment, that is the appropriate way to present that information. So managing those collocations so that nurses can communicate universally with each other is incredibly important. So we can develop the template by using information from the patient information leaflet, using the patient information videos, and using the nursing intervention information from the internet, that we can then create a comprehensive handover using SBAR. From there, we can take the template information that we've generated into a handover and turn it into a role play. This can be done in several ways. So for our verbal handover, it can be expanded and we can incorporate the language needed. And for our role plays, we can go from the reported language, she has been advised to sleep in an elevated position, as a handover, can become a role play. Mrs. Brown, it would be a good idea to sleep with a couple of pillows at night. So here, our information that's reported from a handover becomes part of a role play where we go from the reported language into direct language. And it becomes a role play in itself where we are discussing the situation and answering questions and discussing the outcome with the patient themselves. So there's a lot of things that we can do with very limited materials actually, but we can develop them to create a plethora of materials that we can use in the classroom, both in terms of topic and in terms of handovers and role plays. So I hope you found this useful. I hope this has given you a few things that you think you could go away with today and possibly try in your own classrooms and see how you can develop your own materials from patient information leaflets, from creating your own role plays and handovers. So now I'd like to see what questions any of you might have, and to thank you very much for attending today. So if you'd like to put in there any questions that you have, I'd be more than happy to answer them. And if I can't answer them, I know that Bethan will. So I'm going to give you a few minutes to think about any ideas that you might like to share or any questions that you might have. So if you would like to share ideas, please put them in the chat. And if you would like to ask a question, please put them in Q&A. Oh, okay, where can you find the recordings of handovers? That's a really good question. So on the internet, the NHS actually has handover examples, and there's several on there that you can have access to. So I've been using NHS ones, but if you Google handovers, you can actually find them on nursingstudy.net as well, where they talk about nursing intervention. Okay. Any other questions that anybody? Is there a course for a person who wishes to teach medical English? Yes, there are several. There are several courses. You could contact SLC and we could let you know about that. So Siobhan, you said these are great ideas, but in a busy world, are there materials where some of this has been generated already? So in many cases, if you can give a template to your students, they can generate their own handovers. If you give them the materials links that they can access the materials from things like MIRTA and NHS informational videos. They can access that themselves and they can generate the materials themselves. So if you scaffold and you do one example, you create a model. After that, they can go away and do that themselves. That's the beauty of these activities. It's not teacher-led necessarily. It doesn't have to be teacher-led, and really ideally shouldn't be teacher-led. So the idea is that you can give them a template which is easily accessible in a PDF form and give it to them, and they can work from there by themselves. So you give them autonomy, and then in the classroom time you have then time to assess their language and help them with any pronunciation or collocation work that they need. Nurses are working with foreign patients and their families. Okay, so do you have any recommendations for materials when nurses are working with foreign non-English speaking patients and their families? So Joel, these materials are for everyone. I mean, they really are for non-English speaking patients and non-English speaking nurses. So the lay terms that are used in MRTA, for example, are supposed to be completely patient friendly. So I think the idea there is that they would pick out any key points that they thought were really important for someone to get, and whether they were non-English speaking or English speaking, then that would be useful. Unless you're referring to nurses who are Spanish and speaking Spanish and working in Spain. If you mean that, then I would recommend that you use similar resources to the ones that I've used in the UK and just transfer that to Spain or Italy or whichever country that you're working in. So for example, if you're in Japan, then the obvious place to go would be to their healthcare professional websites or private hospital websites where you might find that kind of information available. Obviously, I work in the UK for a UK company, so my information is based on that. Are there any text books that have lesson plans generated based on role plays and specific disease processes? Yeah, well, there's English for medicine and English for nursing. Those books are available, which are written by Virginia Allen. I'm not sure they actually have complete lesson plans, but they certainly have information very clearly laid out and do work around role plays and disease processes. So maybe have a look into those. Okay, so thank you so much for your participation. It's been great to have your feedback today and to hear some of your ideas, and also to have the opportunity to answer some of your questions. Have a lovely weekend, and the next webinar will be, I think, in the next couple of weeks, so keep an eye out for the post for that one. Take care. Thank you very much.